Welcome again to my weekly Sunday 9 p.m. live video. Okay, so today I'm going to give a talk about Hydrosalphinx, which is one of the topic that was requested by one of you. Okay, so for any of you who have any other topics you want me to talk about, please do put in the comment section, and I will slowly go through all the requests by all of you. Okay, so this topic was requested by one of you a couple of months back, and I've decided to do this topic today. Okay, so what is Hydrosalphinx in the first place? So many of you may not even hear this word before, do not know what a Hydrosalphinx is. Hydrosalphinx is actually the fallopian tubes. You know the uterus got the two tubes, right? I always describe uterus as a body, and you have two hands. The two hands are the two tubes. And then at the end of the tubes, there's these little fingers-like things that actually go and catch the egg. So Hydrosalphinx is something that happened to this tube, cause it to be swollen and blocked. The one criteria, it has to be blocked. So these hands actually closed up and get blocked. And as a result, all the fluid in the Hydrosalphinx, in the tube, all the fluid cannot flow out. So eventually it gets swollen. So actually part of the promo, this is a picture that we used in our promo, my Facebook, and this is what happens. So this is a normal tube, and this is Hydrosalphinx. So usually Hydrosalphinx, the end is blocked, and then all this fluid inside cannot flow out. So the fluid inside stays inside and then accumulate inside. So what are the problems with Hydrosalphinx? Main problem is they don't let you get pregnant. Even though one side only, it already won't let you get pregnant. Why? Because this fluid inside the Hydrosalphinx, this fluid that is collected inside here, actually is we say old fluid or dirty fluid, so it cannot go out. So in a way, it is very toxic. So this chemical environment, you see, this toxin can actually go to the uterus. So the chemical environment of the uterus is not healthy. That's why I always tell a lot of couples who cannot get pregnant. Getting pregnant is not about an egg and a sperm. It is not just about an egg and a sperm. It is also about the chemical component of the surroundings around where the egg and the sperm meet. Because the chemical is very important, the right chemical is very important to make sure that pregnancy gets successful. Okay, so there are many situations whereby the chemical component can be affected, and that's why you cannot get pregnant. Number one is this Hydrosalphinx, because the fluid inside is just dirty fluid. It can be pus, it can be not pus even, it can be blood. Sometimes it's blood, sometimes it's pus, sometimes it's just some clear water, but this water is old water. It is water that cannot flow out. So it is a water that's trapped inside. So it's usually unhealthy fluid as well. And also the water that is produced is usually due to something that happened to the tube. For a Hydrosalphinx to happen, something must happen to the tube. So the tube is not healthy, so it also produces not healthy fluid. So that is why the chemical environment is no good. Other examples whereby the same toxin in fact can happen is when you have endometriosis, also give you a toxic effect, so affect the chemical environment of pregnancy. And also something so simple as stress. Everybody thinks stress is okay. Everybody think they are fine, they can live with the stress, but you don't realize that the stress in your body also produce negative or toxic chemicals that flows around the whole body. So it flows through the whole body. It's not just to the uterus or the ovary, but at the same time, because it does go to the uterus and ovary, stress itself, it is a known cause for a lot of couples today not getting pregnant. It's just due to stress. Okay? So let's go back to Hydrosalphinx. Why does Hydrosalphinx happen? Usually it is a disease of the tube. What disease? Number one, infection. If you have an old infection of your fallopian tube that block the fallopian tube, so over time you will get this fluid accumulated. So infection is one. Number two, endometriosis. Endometriosis itself cause inflammation of the tube. The tube gets swollen and then eventually can get blocked and cause Hydrosalphinx. Hydrosalphinx, I know why the one of you requested Hydrosalphinx. It is because it is quite a devastating thing to have, especially when you want to get pregnant. Because Hydrosalphinx, if let's say you don't want to get pregnant, some people get a lot of pain. Okay, if you have a lot of pain because of Hydrosalphinx, you probably need to get it treated. But most people with Hydrosalphinx, I have so many women with Hydrosalphinx, but they are very happy, no pain, they are well. So we don't do anything lah. We just let it be. Some of them even already menopause, and they're very happy with the Hydrosalphinx. She's happy, I'm happy. I don't care about the Hydrosalphinx. She also don't care about the Hydrosalphinx because it doesn't affect her. So there's no danger, there's no problem to her health, so we just let it be. But for women who want to get pregnant, it is devastating. Why? Number one, this toxic fluid. This toxic fluid can actually, it causes you cannot get pregnant. So it doesn't matter how. Whether you want to get pregnant naturally, you want to try IUI, you want to try IVF, also cannot get pregnant. Also cannot get pregnant. There's no way you can get pregnant with Hydrosalphinx. It's like almost an impossible thing. Almost. I like to say almost because I will say human is not robots. So there's no rule that is 100%. But almost. Okay, of course miracles do happen, but rarely. But another thing is to solve this problem. Typically, if you look at the textbook, what would they say? You want to get pregnant, you have Hydrosalphinx, you have only one option. Remove your tubes. So if you remove your tubes, especially if you have Hydrosalphinx both sides, most women, they have it both sides. Occasionally, some people have it one side. So let's say you have Hydrosalphinx both sides. Then the only solution is to remove it. So you remove it, how are you going to get pregnant on your own? No way. According to the textbook, you're supposed to remove it and get pregnant with IVF. So you can only get pregnant with IVF. But there is one problem with Hydrosalphinx. When we want to get pregnant with IVF, we also know IVF success rate is not very high. It's not very high. So let's say you do one time IVF, you spend that 20,000 and then you are not pregnant. Never mind, doctor say can try again. Try one more round, spend another 20,000 and you're still not pregnant. If you are pregnant, of course it's fine. You'll be happy, you are pregnant, your wish fulfilled. The surgery to remove your tubes was all worth it. But what if you're not pregnant? You will be devastated. It's really devastating. Because you have reached a point whereby you do not have your tubes anymore. And nobody can replace your tube anymore. But IVF, you have tried twice. And you already spent 40,000. How much more are you going to spend on your journey to try and get pregnant? So you'll be devastated. I like to quote a few cases that I've seen. One lady, that's what happened. She was asked to remove her tube. So she removed her. Nicely, she removed her tube because that is the solution to her problem. But after removing her tube, when she tried IVF 1 time, 2 times, 3 times, she even went, the third one, went overseas to do her IVF, but still not pregnant. So much money spent. To her, it's like end of the world. There's no way. She has done so much. when she came to see me after all her failed IVF, I can see she's like, you know, really going crazy and like so much anger towards the doctor who removed her tubes. So that one lady that I saw almost 20 years back during the first few years of my when my clinic was open, when I saw her, it enlightened me one thing, that is, you have to find a way to help them other than removing the tube, because when they remove the tube and they're still not pregnant, they will be devastated. So along the way, I see a few more other cases the same. They have removed their tubes, they have done IVF, they didn't get pregnant, some go into depression, some, like that lady, is like a lot of anger, like going crazy, like, you know, you're being lost, you reach a dead end, you cannot turn right, you cannot turn left, there's no way you can escape, and there's nothing you can do. So it is actually a very horrible thing to do. Then there was this one year that I went to a workshop in France, and then I met this lady who does fertility, and we had to travel from France to Germany in a bus, whereby we have to go to Germany, because Germany we have cadavers, in France we don't have. So we actually crossed the border just to operate on dead bodies. So on the way there, I had this lady, so I talked to her, what do you do with all your Hydrosalphinx? Do you remove their tubes? And she said, yes, we remove. Because I agree with her, that is what is written in all guidelines, all textbooks. But does your women in France have any problem removing their tubes? And she said, no, they are fine. Why? Then I realized, number one, they don't need to pay 20,000 to do an IVF, and they can do as many IVF as they want. I mean, if I can get my IVF free and I can do as many IVF as I want, eventually I'll get pregnant. Then I won't be so devastated, I won't be so lost, I won't be so desperate. But that's not the scenario in Malaysia, because IVF is not free. Even in government hospital, I still need to pay more than 10,000. IVF is not free. Then it goes back somewhere along the years that I've been working. I have seen women who come to me and they had surgery done. You must understand, IVF is only in Malaysia, let's say maybe about 20 years. 30 years ago, hardly any IVF or almost none. So this lady is actually quite elderly, and she told me that her tubes were all blocked, and the doctor did a surgery to unblock the tube, and she got pregnant. And then it struck me, why are we not unblocking the tubes? Okay, there is an argument to that. I know why. One of the reasons is we always think that the theory behind it is Hydrosalphinx doesn't happen on its own. It doesn't happen for no reason. The only reason why it happened is because the tube is no longer healthy. So if the tube is no longer healthy, then if you keep the tube, even if you unblock it, it's not likely to get you pregnant. The chances is not very high, number one. Number two, it may block back because the tube is not healthy anyway. Number three, if you get pregnant with an unhealthy tube, you may end up with a pregnancy in the tube, because the tube have a function. When we get pregnant in the tube is supposed to bring the pregnancy into the uterus. If you have a tube pregnancy in the tube that is not healthy, the tube cannot bring the pregnancy back in. So the pregnancy is going to stay in the tube, and that is an ectopic pregnancy. Ectopic pregnancy is life-threatening to the mother. So it doesn't make sense to keep this tube. But many women are devastated. So what is the balance? So that is why through the years, what I do is I always tell women that what is going to happen, what is the right thing, that is removing your tube and do IVF is the right thing. But before you walk that path, I need you to think, 2 times, 3 times, 10 times, 100 times. Because IVF may not succeed. How many times of IVF can you do? You think carefully. Let's say you do your IVF and it's still not pregnant. Are you able to accept it that you lost your tubes for the rest of your life and you have no baby forever and there's no way we can get you pregnant anymore? Can you accept that? If not, option 2, unblock the tube. Because there are women in the past before IVF existed, they unblock the tubes. And there are women who can get pregnant, even though the number is not a lot. But there are. You run a risk of ectopic. Are you willing to take that chance? Do that first. If you're still not pregnant, then only remove the tube. But you must be prepared for 2 times surgery now. 1 surgery, unblock the tube. Give yourself a second chance. Give yourself 2 years time. Try, get pregnant. Pregnant? Not pregnant? Go in, remove your tube. Because women, when they have tried their very best, and they know they have tried their very best, and then you remove their tube, even if the IVF is not successful, usually they can accept it. That is the only difference. Because if I remove your tube before you have unblocked it, one day definitely you will read somewhere in social media, in Google, that somebody unblocked the tube and got pregnant. And you will be like, why did I not unblock my tube first? And all your regrets will come in. And this will push you into depression and everything else that can come after that. So, one thing I realized in a lot of women, that's why when the operating room, the nurses used to ask me, Doctor, why the uterus so much problem, but you never remove the uterus? You just remove the fibroid, you remove the cyst, but you never remove uterus, because majority of the other gynaes would have just removed the uterus. My answer is that because when any woman lose one part of her organ, it's very hard for her to accept it mentally and emotionally. Not many women can accept it. Women who can accept it, they are very simple. They come to my clinic, they say, Doctor, isn't it better to remove the uterus? If that comes out of your mouth, yes. But if that didn't come out of your mouth, then I will always give you the option of just removing everything else, because many women rather remove everything else, have a chance of maybe it will grow back, but I want to keep my uterus. This is psychology. We need to think about women's psychology. We cannot just think about women physically. Because I've seen many women who go into depression when they lose their uterus, when they lose their ovaries. They get very emotional. They're very hard to control their emotions. Why do you think they cannot control their emotions? What has the uterus done to their emotions? Nothing. Physically, scientifically, there's no effect. But it is the loss of an important organ that defines you as a woman, that make you emotional. So it is an emotional or a mental or psychological aspect of women. So taking out a tube, it has to be a decision almost similar as chopping off your leg. You chop off your leg, you can never walk back like normal. You take off your tube, you can never get pregnant anymore on your own. So it is something that women need to really be convinced that that is the only option. Then only that can be the option. So along the way, I have unblocked tubes, and I have patients who conceive. I'm not saying all, and I also never say I can unblock all tubes. When women come to me, they want to unblock the tube, I will tell them it is a 50-50 surgery. Because I have to confess, not all tubes can be unblocked. But Hydrosalphinx is the easiest to unblock. So Hydrosalphinx I can unblock, but not all tubes can be unblocked. But Hydrosalphinx is the easiest to unblock because it is closed up at the finger end, everything swollen. So we just need to cut the ends, open it back, and the fingers will all be released. I have pregnant women, women who got pregnant with this situation. In fact, one of them is currently pregnant with the second pregnancy already, which I'm really happy because I unblocked her tubes and she conceived twice. But not all, and some of them may block back. So last couple of weeks, I had this one case. I want to share to you because there's two causes of Hydrosalphinx. One is due to previous infection and one is due to endometriosis. Previous infection is usually an old infection. Most of the time when we go in, she doesn't have any active infection anymore. So we just need to release the tubes and that's it. We have done our job. The rest, we leave it to nature to decide. But in endometriosis, it's a little bit more complicated. So this particular lady, she has Hydrosalphinx. Somebody has opened up her tubes before a couple of years ago, but she still cannot get pregnant, and now the tube blocked back. So when she came to see me, she already decided she wants to remove her tube. And she has already think it through. So this case I will do for her because she knows she has unblocked it, but she's still not pregnant. So removing her tube is not really an option anymore. So she decided to remove it. And when I went in, I thought it was due to an infection because I couldn't see anything else on the ultrasound scan except for the Hydrosalphinx. But when I went in, it was stage 4 endometriosis. I spent hours on the surgery because opening the tube is a simple surgery. Cutting the tube is a simple surgery. I told her, cut tube very easy one. It's easier than unblocking. I can finish in 10 minutes. And true, because cut off only ma. You know, you have 2 hands. I just chop here, chop there. It's 10 minutes job. Ended up, I did a 2 to 3 hours surgery. Why? Because I saw the endometriosis. If I am going to remove the tubes without removing the endometriosis, I am not doing her justice because the endometriosis surrounding the uterus is also going to forbid her from getting pregnant. So at that time I was like, I could just unblock the tube again and remove the endometriosis because apparently the first doctor did not remove the endometriosis, just unblock the tube. So you just unblock the tube, you leave the endometriosis behind, she's not going to get pregnant. And because the endometriosis is still active in her body, her tubes got blocked back again. So, but anyway, since she has decided, let's not subject her to a third surgery. So I remove her tubes, but I spend the next 2 hours removing the endometriosis. And I would really hope that she can get pregnant with that. Because if I don't remove her endometriosis, I'm not doing her justice. Because the endometriosis will not make her pregnant and IVF would not work with so advanced endometriosis. She had stage 4 endometriosis and all we saw on ultrasound scan was just Hydrosalphinx. So this is a very sad case because I felt that if earlier on somebody would have treated the endometriosis properly, she would probably have a chance of getting pregnant already because she got no idea she got endometriosis. Even though the doctor opened the tube, still no one told her she has endometriosis. So the fact that no one told her she has endometriosis means only one thing, which means that no one treated her for the endometriosis. So it is a very sad thing because if somebody would even like give her Lucrene, give her Visan, things would have been different. So it is a very sad case, but that's it. So this is Hydrosalphinx. So back to what I usually advise most couples who are trying to get pregnant. If you have tried 2 to 3 years, especially if you are young, still young, and you have tried maximum, I feel you can only give yourself 3 years. And if you still have not get pregnant, you need to do a laparoscopy to go in and see if you have endometriosis before it gives you more problem, like Hydrosalphinx, for example, and then it sends you to a dead end road, you know. So you have to look at it. That's why a lot of times women who didn't want to do a laparoscopy at that time and keep trying to get pregnant with many different methods, at the end of the day, if they are still not pregnant, you will see the endometriosis surfacing itself by producing chocolate cysts, adenomyosis, and Hydrosalphinx, because these situations you can see on ultrasound. But 3 years ago, before that, you can't see anything from on ultrasound, does not mean that you have no problem inside. But if you're more than 35 years old, 3 years is also a bit too long to wait. Probably 1.5 to 2 years if you're still not pregnant and you have done everything else. Because if you're 35 years and above, as in my previous video I mentioned, you should only try for 6 months. If you're not pregnant, you should start testing everything and doing every other thing you can do, and you have done everything else that you can do and you're still not pregnant after 1.5 to 2 years, you still need to do a laparoscopy to see what's going on inside and why the hell are you not pregnant. Don't delay, as I always advise, because pregnancy, when it comes to trying to conceive, time flies. Within months, you are 1 year. You just tried 12 times to get pregnant and you are 1 year down the line. You try another 12 years, you have already wasted 2 years. You try another 12 times, you waited 3 years. Time flies with this conception journey, trying to get pregnant, time flies. So don't waste your time. In no time, you're too old to get pregnant. In no time, this endometriosis would have surfaced and it's a bit too late to try to help you sometimes. So don't delay the laparoscopy that you're supposed to do if you cannot get pregnant and you have done everything else and fixed everything else and you're still not pregnant. This is one thing you need to do. Alright, Charlene just asked what type of fluid trapped inside the tube, and I mentioned earlier it can be anything. It can be from blood to pus, as well as just clear fluid. Hanisa asked, can I know the symptoms and how doctor can diagnose? Can scan see it? Yes, Hydrosalphinx is one thing you can see easily on ultrasound scan. And the other way is when you do your tube test. When you do your HSG, when we pump in the dye, that is another way to see Hydrosalphinx. Very mild Hydrosalphinx, you need to have the tube test to determine. But in very severe Hydrosalphinx, ultrasound scan also will be able to tell. But sometimes we may mistake it as a cyst. Because cyst is a collection of fluid, Hydrosalphinx, it is the tube that is swollen with fluid inside. So everything is fluid. Very often, there are a lot of women who come and tell me and say, Doctor, I have a cyst. Doctor, I have a cyst. But when we scan, it's actually Hydrosalphinx. So it can be confused with a Hydrosalphinx. So if you see one cyst only, then it's a cyst. But if you see like so many cysts, then you have to think maybe it's a Hydrosalphinx, because when you do an ultrasound scan, you will see there's actually many collection of cysts. So it can be misinterpreted as 1 cyst, 2 cysts, 3 cysts, but actually it's not cysts, it's all Hydrosalphinx. Yeah. So to confirm really a Hydrosalphinx is actually doing the tube test or HSG. Okay. Wing Yan asks how to know whether one person is having Hydrosalphinx. Okay, depending on what's the cause of Hydrosalphinx. If the cause is due to endometriosis, most of these women will have some amount of pain. If the cause is due to old infection, when you have the infection that time, maybe you have tummy bloated, a lot of gas, a lot of discharge, but the infection is an old infection that caused the Hydrosalphinx. Now, if you no longer have any more infection, you can actually be quite well, you can actually be very well, don't feel any pain at all. A lot of women with Hydrosalphinx, actually, they don't know they have Hydrosalphinx because they don't feel pain anymore. So yes, you can detect Hydrosalphinx. Yes, Fatin, you can just do an ultrasound scan to detect Hydrosalphinx, but only in very advanced cases, as I mentioned, it can always be mistaken as a cyst. And for mild Hydrosalphinx, we need to have a HSG to determine. Shirley Lim asks, Dr. Tam, last time I test my fallopian tubes blocked. After that, I change to other doctor, then check one more time for fallopian tube. The doctor said my tube no block. Okay, so Shirley, I think these sort of things happen all the time. It's because there are multiple reasons why the tube can be sometimes blocked and sometimes not blocked. Because our tubes can be blocked mentally. You know, we can mentally block our tubes, because if we are so stressed, we can sometimes cause the tube to be blocked. The tube got muscle, the muscle can go into spasm and block the whole tube. So if one time you see is blocked and another time you see is not blocked, I would prefer to believe the not blocked part lah. But the health of a tube is not purely blocked or not blocked. We also want to see whether the fluid flows in very easily or the fluid doesn't flow in easily. Healthy tubes, the fluid flows in very easily. So sometimes the fluids that are not flowing in easily, very slow in getting in, sometimes it's still not blocked, but it's very slow. This type of tubes are also more easy for you to block it, either mentally because you cause the muscle to cramp, or even occasionally when something else is just there, just pressing on it, it will be blocked because it is already partially blocked in the first place. So still, ultimately, I think, Shirley, you still need to see whether you're getting pregnant or not. So if you're still not getting pregnant and you do not know why you're not getting pregnant, we will still want to see whether the tubes are healthy or not. It is not just about having blocked or unblocked tube, whether you can get pregnant, but it is also about a healthy tube and a not healthy tube. And to see whether a tube is healthy or not, laparoscopy is something you probably still need to do. Next question is by Karen. Karen Yan asks, "Hi doc, I've done endosurgery 3 years ago. Do you suggest for laparoscopy again?" Yes, if you're still not pregnant. All my patients, I always advise them this simple thing, and I hope they listen to what I say. When you have an endo surgery done, you must be pregnant in the next 1 year to 1.5 years. If not, your endo is going to come back. Then by 3 years, you are starting all over again. You go through the whole process again. Surgery, trying to get pregnant. Surgery, trying to get pregnant. It makes me feel very sad to see women going through 3 surgery, 4 surgery, 5 surgery, just to get pregnant, because it's obvious that they did not do it right. It's obvious that they have been wasting their time because they didn't make enough effort to conceive before the endo come back. And I know it's not easy for women to do everything they can, but sometimes the practical thing I feel to some women, I always tell them, is if you're still not pregnant and you think you have done everything, maybe it's about time to let go. Because if not, it's another surgery. But honestly, I respect these women who can go through 5 surgeries just to get pregnant. It is not something many women can do. Not many women can do that. Majority of women, I think, is after the 2nd or 3rd surgery, they will give up. But I have seen 5 surgery. I really respect these women. They are so determined to get pregnant, they can keep getting surgeries done one after another. So it's not easy to be these women, and I guess it's not easy to be any women in the first place. But the right thing to do is don't end up like that. After an endo surgery, you must be very proactive in getting pregnant. You must do everything possible that you can do on earth within that 1 year to 1.5 years. Don't sit down and keep trying to get pregnant on your own. It doesn't work that way. You must be more proactive. That's why when these women come to me, I like to ask them, have you done this? Have you done that? Have you done that? They have not done. The typical scenario is they have not done so many things even after the endo surgery. And that is why they're still not pregnant. That is why, as I have mentioned in many of my fertility videos, there's no reason a woman cannot get pregnant in today's day and age. There is only 2 reasons why women don't get pregnant. One is they cannot afford to get pregnant because some of these things do cost a lot of money. Number two is they are not willing to walk the path. That means we tell you have to do this, you don't want. We tell you to do that, you don't want. Of course, some is due to religious reason, but some is just themselves not willing to do it, which we cannot help you. No, we tell you need a laparoscopy. You say surgery, I don't want. I ask you to do IVF. Then you say, I want to get pregnant on my own. So you don't want this, you don't want that. How do you expect us to help you if you do not want to walk the path? If you are willing to do everything on earth to get pregnant, I guarantee you are already pregnant. The reason why you are not willing is either you yourself have personal reasons why you are not willing to do what doctor asks you to do, or religious reason for you not wanting to do it, or financial reason. So financial reason, of course, nowadays government is trying to help. We have funds, charity for IVF. Now you can take your EPF money to do IVF. So money reason, some people are trying to help, okay. Religious reason, I can't help you because I've also seen many women, some they're still willing to do even though their religion forbids, but some are not willing. So really I cannot help you. I cannot judge. This is between you and God. I guess some people are more religious and some people are not so, and some people place getting pregnant more important than religion. Some people place religion more important than getting pregnant. So I can't judge. It is your decision. But a lot of other women don't have that. In fact, majority of women, they don't have religious reason for not doing it, and they also don't have money reason. They just have certain principles that they cannot do it. Ask them to go for fertility counseling, they say, no lah. Ask them to do laparoscopy, no lah. Ask them to do IVF, no lah. How do you expect us to help you? And these are simple things. I have not talked about sperm donor, ovum donor. I have not talked about surrogacy. If you're willing to do everything, there's so many things you can do. Are you willing to walk the path? So Karen, I think you have missed the boat because it's already 3 years. You probably need to see your gynae again and reassess everything all over again and find out, number one, it's not just whether you need to do a laparoscopy. What have you missed in these 3 years? What have you not done in these 3 years? Make sure you do it after your next second endo surgery. Don't again, I don't want to do this, I don't want to do that. So please get it sorted out. Cynthia, hi. Hi Esther. You have done laparoscopy 3 years ago and still cannot conceive. So Esther, you have a miscarriage 7 years ago, and after that you cannot get pregnant. It is such a typical scenario. I've seen so many women. I do not know about your miscarriage, but I've seen so many women. First pregnancy, very easy. Get married, short while, plan, get pregnant, but miscarriage. And one miscarriage is enough, no more pregnancies after that. This is so typical a story. There are ways to solve it, and the only reason I feel, Esther, that you're not pregnant is because you have not solved all your problems. So I believe there's still other things that you have not done. But I wouldn't know because I do not know your entire story. As I say, it's very, very rare for women not to get pregnant if they have really done everything. Samantha asks, I have done HSG twice, but they cannot confirm if my tube is blocked. Why is it so? Do I need to go through that again? I cannot answer your question because I do not know what you mean by they cannot confirm. But of course, ultimately, when HSG cannot give you an answer, the next step is to do a laparoscopy because laparoscopy sees better. Fatin asks, do we do HSG test at your clinic? Yes, Fatin, I do have a HSG test in my clinic. We just started it this year. So previously we do not have. So Shirley Lim talked about her tubes, and if you find it very hard to get pregnant, Shirley, I will still investigate further on your tube. Because why is it that one time is blocked and one time is not blocked? Could you be having a not so healthy tube? Ideal asks, I have done my laparoscopy in July. Doctor detect I have Hydrosalphinx. How long I can try to conceive after laparoscopy? Okay, my first question to you, Ideal, is why did you have Hydrosalphinx? Is it due to an old infection or is it due to endometriosis? An old infection is fine. It's not a progressive disease, so you can give yourself, no matter how much time you want, you are still fine. But I feel that if you want to anything more than 1 or 2 years is not worth waiting, because if it's going to get you pregnant, it should get you pregnant within 1 year. Also need to look at how old you are. But if let's say after 1 year you're not pregnant, the chances is unlikely to get you pregnant anymore the longer you wait. There may not be advisable to wait longer. Might as well go for your second surgery to remove the tube. Unless let's say after 1 year you're not pregnant, your tube no longer have Hydrosalphinx, then you can also still proceed with IVF. You do not necessarily need to remove your tube if the Hydrosalphinx did not come back. But more importantly, you need to know why. But if your Hydrosalphinx is due to endometriosis, then you need to get pregnant as soon as possible. Okay. Ideal also asks whether she can take pineapple when trying to conceive. No big deal, right? Pineapple. Poor pineapple. Always being blamed for a lot of things. Okay. Esther again. I've done HSG 3 years ago and doc confirmed me my tubes are fine, but still I cannot conceive. Done IUI once a year ago, yet I'm not successful. Experienced miscarriage 3. As I say, Esther, your reason for not getting pregnant is definitely not your tubes. Your HSG is fine. You got pregnant before with a miscarriage, which means that most likely your tubes are fine. Do you need another HSG? I think there's no harm, but more importantly, you need still to find out why you're not pregnant. As I always say in fertility, don't do IUI blindly, don't do IVF blindly, because all these IUIs and IVFs are done for a certain purpose. If you do it blindly, that is when you always get a lot of not so successful stories, because you didn't have that problem that required an IUI, or you didn't have that problem that required an IVF. So if you want to know more, Esther, actually I will be running another fertility seminar. I run fertility seminar every 3 months for this MCO. I mean, ever since the beginning of MCO, because now I'm doing it online, I can do it more frequent. So there will be another fertility seminar this December. Do stay, follow my Facebook. We will post all the fertility seminar event up soon, somewhere in November, and please register. Then you understand better. Because Esther, I feel that you don't really know what's happening with yourself. You need to know what's happening with yourself. So please attend the fertility seminar, have knowledge and know what you are dealing with. Because when you ask questions, it obviously shows to me that you got no idea what's happening to yourself. Please, knowledge is very important. So I have this fertility seminar mainly to give knowledge to all the couples out there who are trying to conceive. Honey asks, I am one of the rare one, did everything but still not successful. Honey, I would still want to know, as I said, I don't think you have done everything, because I can see that, as I mentioned earlier, there is still donors, there is still surrogacy, but okay, these are not allowed in the Muslim religion. But to say that you really done everything but still not successful, I still need to look at your entire case. As I said, I hardly see any couples who have not got pregnant if they have done everything. You still need to know what is your problem. But unfortunately, some of the problems, because a lot of women spend many years trying to get pregnant, and they have reached a stage where they are a bit too old for it already. And the solution may still be donor egg. But again, as I said, Muslim religion will not allow such things, but it's still between you and God. Casey Lee asks, I've done 8 IVF transfer but all failed to implant. In March this year, I had a laparoscopy. I have found silent endo stage 4 and adeno. I have removed endo and treat the adeno with Zoladex. I want to do another transfer, and if still fail to implant, yes dear, you need to remove your adeno. When I saw the word you did a laparoscopy to clear your endo but never remove your adeno, my heart sank a bit for a while. At the end of the day, we still need to remove adeno. I have many, I just have so many adenos who got pregnant, but I removed their adeno. You go for your FET, whatever it is, you still have embryo to transfer, by all means go ahead. Few things that you can think about. Number one, because your embryo is done before your endo was removed, you must understand the endo can produce poor quality embryos. So your embryos are also before your endo is removed. So your embryo quality may not be as perfect as it should be. So one thing is, if you do not want a surgery, is to redo a new IVF cycle without the endo as soon as possible, because your adeno is going to come back within a few months. So do your IVF as soon as possible, another new set. And if you still have extra embryo, if this new set did not get you pregnant, please remove your adeno, okay? And your endo, I think if you want to look at my endo video, then you will understand one thing. Not every doctor in Malaysia can remove 100% of stage 4 endometriosis. So I do not know which doctor you had it. I roughly know who are the doctors who can do it. There are doctors who can do it, but not many. So, and I feel that doctors who can remove stage 4 endo 100%, they are very confident in removing adeno as well. So if your adeno is not removed, I am a bit questionable about your surgery itself as well. So Casey Lee, you may need another surgery eventually if you're still not pregnant. So Casey Lee is an example that I have mentioned so many times. She has done endo IVF 8 times, 8 transfers, and she's still not pregnant, because endometriosis do not let you pregnant even with IVF, number one. Number two, IVF, endometriosis cannot see on ultrasound scan. So even stage 4 cannot see on ultrasound scan. So that is why if you're not pregnant after a lot of things that you have done and you're not pregnant, you need to have a laparoscopy to see your endometriosis. And the ideal situation is still to look for a doctor that can do stage 4 endometriosis and total clearance as well. No point you go and do a laparoscopy and then, you know, because I get so many of these out cases who come and see me and they will tell me directly, like 2 days ago I did one surgery on one lady who cannot get pregnant. 3 years back she did a surgery for endometriosis. And the doctor told her, you have some endo in your bowel, in your urinary tract that I didn't remove. I just removed the ones in your ovary and around your uterus. It only means the endo is still left behind. And when you leave endo behind, they spread again very fast. Very fast, soon you'll be having endos in your ovaries again. So in this particular lady, even though her ultrasound scan was normal, but because she told me that story, I told her, you're still not pregnant, you probably need to go in again. And fair enough, we went in again. It's not just endometriosis in her bowel and her urinary tract. There was tiny chocolate cysts in her ovaries as well, which we didn't see at all in the ultrasound scan because it's so small, and both sides of her ovaries also have chocolate cysts. That's why she's again not pregnant, because when you leave disease behind, they always come back. The place that I have gone for all my endometriosis surgical training is in Bangkok. In the past, they like to do this every year, and I go there every year for their workshop and their seminars, and they invite all the world-class endometriosis surgeons to teach us. And I always remember this particular friend of mine that is a doctor from Thai. She always say endometriosis is like karma, you know. If you don't clear, it will come back. You don't clear 100%, it will definitely come back. So it is like karma towards doctors as well. No? It's like, I don't clear it, I have to face it again. It keeps coming back. So in endometriosis, you need to remove all endometriosis. You cannot leave anything behind. And you have to aim towards total clearance. So leaving adenomyosis behind, I'm already very worried because adenomyosis grows back in the next 3 to 6 months. If you successfully pregnant in your next transfer, well and fine. If not, Casey, you are back to square one. You're back to square one. Adeno will be back in the next 3 to 6 months. I know the strategy is put you on Visan, Lucrene, and then immediately do transfer after that. That is the right strategy, true. But it had better be successful. If it's not, then you're back to square one. And Casey, please attend my fertility seminar. All IVF couples, I always say you must go for fertility counseling first before you go for IVF. Because all your failed IVFs are going to affect you mentally and emotionally towards the success of your current IVF. That's why we know women who go for fertility counseling and don't go for fertility counseling, the IVF success rate doubles. So please go for at least that's all I can help you for now. Go for fertility counseling. Want to know more? Either if you have time, attend my fertility seminar in December. If you don't have time anymore, then please call up my clinic, make an appointment for fertility counseling. So Shirley mentioned about IUI. Again, my story is the same. You don't do IUI for no reason. You must know why you're doing IUI. If you're just doing for the sake of doing, just because I'm not pregnant, I do IUI, the success rate is not high. Okay, Fatin asked, if we get egg donor and use my husband's sperm, will my kid have my DNA or just the donor and my husband's? Yes, this is a thing that a lot of people ask. Because yes, of course, DNA wise, we know it is not yours, it belongs to someone else's. I mean, I'm not a Muslim, maybe I should not say this, but I always feel it's very funny if Muslims can adopt a baby and just breastfeed and that baby is yours. And why is it I cannot have a donor egg and give birth to the baby and breastfeed the baby and the baby is still mine, right? So I just feel that religion sometimes existed long time ago, and this thing never existed, was never thought of long ago, but adoption was accepted as a norm in the past. So there are ways where religion can accept adoption and treat an adopted baby as your child, but religion has not answered the donor egg part. But the other thing about donor egg, we know one thing is that there is such a thing as fetal programming. In these last 5 to 10 years, actually I gave one fetal programming talk once in a parenthood seminar, and it actually received very good, many people not aware of fetal programming. And we know that there is a lot of mix of DNAs between the mother and the baby throughout the entire pregnancy. Okay, our DNAs go to the baby DNA go to mother. That's why we say mother and baby got telepathy. Those of you who are mothers, you will know your baby wake up at night, you are the first to wake up, your husband cannot wake up one. Baby cry also, you wake up, your husband cannot wake up one. You have to really, push your husband. Wait, a lot of couples, they take turn taking care of baby, so it's like, I take care tonight, you take care tomorrow. No use one, your husband can't wake up even if the baby cry. It's because mothers and baby have telepathy. It's also because there is actually a lot of exchange of DNA. So you have DNA, you have your baby's DNA in your body, in your brain, and as a result, if your baby's brain is awake, your brain will be awake too. So we know that the mother is very important. You program the baby in many aspects, even if the baby is not DNA yours. That's why this one lady that is my friend, someone I know, asked me, she wanted to adopt a baby. So I told her between adoption, it's better you go and get a donor. Because donor, you get pregnant, it is still you who program your baby. So you character your baby, a lot of characteristics, illnesses, and everything, you are programming the baby. So you play an important role. Because we know that fetal program determine the baby's character, the baby's health in the future. So, but if you adopt, you tend to have a lot more problem, because the person who is programming that baby is a mother who has decided not that she doesn't want the baby. So it is never the same. So a lot of people find that, you know, when they adopt a baby, they actually find a lot of problem, and they always blame it because it's not their DNA. But actually it's not the DNA, but it is the fetal programming. Because we understand that genetics, there are millions and millions and millions of genes, and not all genes are active in every individual. So who activates certain genes? It is still the mother that is controlling it during the 9 months of pregnancy. So that is why to a lot of egg donors, when they understand this fetal programming, they will be able to accept egg donor if they were to go for IVF. But egg donor is also not say everyone needs an egg donor, okay? So it's only certain people. I'm also dying to find a day to write the book. Actually, I feel like writing a book on fertility too, after I've written my ways to prevent cesarean birth. And I'm also very surprised, my book is almost sold off already, so I probably would want to write a book on fertility. But I told myself I will wait for 2 weeks quarantine to write the book. But until today, I still have not been asked to quarantine. So touch wood, I don't want to be quarantined. But if I'm being quarantined, I'll probably write the book. Any of you have any more topics that you want to talk about, that you want me to talk about, please write it down in this comment section. Then I will talk it in one of my coming future Sunday 9 p.m. live video. Yeah. So for the old videos, you want to know more, please subscribe to my YouTube channel in this link below, and go through all the videos. I have so many videos by now. I don't know, maybe 30 over by now. Just go through and see whatever topics you are interested, you just go through it. Any topics you want me to talk about, feel free to put it down in the comment section. Okay, so that's all for now, and see you again next week, 9 p.m. Sunday. Bye.